2019, the city of Sammamish, quiet community east of Seattle, was shocked by the death of two classmates from Skyline High School who died within a month from one another from an accidental fentanyl overdose.
I lost my son Lucas in September 2019 to fentanyl. He was 16-year-old. He was a junior in school. It was supposed to be his first day after summer break. He had actually appointment scheduled with his counselor to talk about scholarship. I found him not unresponsive on Monday, 8 a.m.
Just a month earlier, Olga David of Bayer and her son attended a funeral for Tom Beatty.
I talked to Lucas after funeral, even though I had no idea that Lucas buy pills. But I talked to him and I say, Lucas, I don't know what it is because nobody was still saying about fentanyl. But I said, I want to make sure that I'm not mom who loses a child.
Following sports-related back injury, Lucas was doing prescribed physical therapy and occasionally taking ibuprofen to deal with the pain.
Now I had to say that all of a sudden Lucas passed away.
Her son became one of the 8 teenagers who died in the King County in 2019 from opioid overdose. The investigators concluded Lucas took what he thought to be Percocet, a powerful painkiller, but the pill was laced with a deadly dose of fentanyl.
And then I heard that from his friends, it must be fentanyl. And then I started hearing, I'm like, what is fentanyl?
A lethal dose of fentanyl is as small as 2 milligrams. The year Lucas died, Seattle Police Department seized over 200,000 fentanyl pills, and the numbers keep growing, getting to over 750,000 pills in 2022. Jacob Galvin, acting special agent in charge of the Drug Enforcement Administration in Seattle, speaks about the alarming results of the laboratory tests.
We're seeing fentanyl in everything, not only the counterfeit pills, but we're seeing it in cocaine and methamphetamine. All the counterfeit pills have it. What we see is that 6 out of 10 of these fake pills contain a lethal dose. You can't tell the difference between a real pill and a fake pill.
Since the teenager's death, educational programs were introduced in local schools and naloxone kits distributed to staff to treat accidental overdoses. Olga David of Bayer, who leads these days an Early Bird Alliance initiative to provide families with resources about drug addiction, says it is an uphill battle.
I honestly can think it can happen to anyone. Just everyone needs to be aware that, well, there is things that is sold or distributed on the street, which might be a poison.
For the U.S. law enforcement agencies that are dealing with the opioid crisis in the country since the 1990s, fentanyl poses a new kind of threat due to the simplicity of its production.
Cocaine is manufactured differently. It's grown. You need more infrastructure. You need more land. With fentanyl, these are just chemicals that are used to produce this. Precursor chemicals made in China are shipped to Mexico. Those chemicals are taken by the cartels, and they make the pills that are then ultimately smuggled into the U.S.
And the drugs trafficking brings violence to the heart of urban communities. Illegally modified automatic weapons, hundreds of thousands of dollars in cash, and 27 kilograms of illicit fentanyl-laced pills were seized from a Seattle apartment in March as part of a nationwide law operation against synthetic opioids. The White House says it is building a global coalition to prevent illicit drug manufacturing, detect emerging drug threats, disrupt trafficking, address illicit finance, and respond to public safety and public health impacts.
By bolstering our work together in the North American drug dialogue with Mexico and building on a new global coalition against synthetic opioids, we're working to get these killer drugs like fentanyl out of our communities.
Chinese Foreign Ministry spokesperson Mao Ning says there is no illegal fentanyl trafficking between China and Mexico.
China has not received any notification from Mexico that it has seized controlled fentanyl precursors from China.
Fentanyl is a shapeshifter, which makes it elusive target. Some fake pills are made to look like their legitimate pharmaceutical counterparts. Others are dyed in rainbow colors to make them more attractive to younger customers. The newest version of fentanyl is coming to Washington state in a powder form. Agent Galvin says social media companies should be held more accountable for identifying drugs promotion on their platforms.
The cartels, they've mastered social media. They use social media as the avenue to get these into communities and to people. They use emojis as different codes. Your conversation can just be a series of emojis of, what you want, how much it is, where to meet, and that.
With the risk of overdose so great, why would drug cartels sell fentanyl-laced pills that could kill their clients?
What people don't understand is that the cartels are concerned with one thing, and that's just making money. And they don't care about who they harm, who they kill, as long as they keep making money. And with the social media, because they're able to access millions of people, they'll take that risk.
The U.S. Attorney Nick Brown urges to be realistic about curbing the threat.
Fighting cartels is an ongoing effort, and we don't want to get too far ahead of ourselves and talk about dismantling. We're really focused on doing everything we can to disrupt these organizations. Anytime that you can arrest as many people and charge as many people as we have across the country, it's going to have an impact.
While the law enforcement representatives admit they focus on stopping the heavy dealers, city residents are worried for safety from drug users. On a 3rd Avenue in Seattle downtown, drug-related offenses rose 40% in 2019-2022. Scenes like this, an ambulance responding to address an emergency at the hot spot of drug sales right next to the bus stop, are still frequent. In Ballard neighborhood, reopening this public park that has been closed for over a year for restoration following the forceful removal of homeless encampment has been met with mixed feelings.
I was very nervous actually watching the fences come down this morning.
Melissa Wax lives just across the street from the park.
People were dying in the park. I saw people being drug out in body bags and just in fires and explosions and drug abuse and fights. And as a parent with 2 kids that walked to school right through here too, it was terrifying.
Among the local families, performers and businesses that came to celebrate park reopening, there were protesters.
17 people died in this district. That is disturbing.
2022 was a record-breaking year with 310 homeless deaths in the King County, with fentanyl overdoses leading the charts. Council member Dan Strauss says the local authorities are better equipped to deal with the crisis now than at the beginning of the COVID-19 pandemic.
We've got the Unified Care Team and the Regional Homelessness Authority operational within our city, which was not in place in 2020. And the Unified Care Team is expanding to neighborhood-based models so that we can scale our response to the level of the crisis.
Scattered on the pavement surrounding the Ballard Commons Park and in front of the adjacent public library, there are dozens of bronze leaves with names and dates of life of homeless people from the area, including one commemorating Christy Hughes, who, according to the Leaves of Remembrance obituary, died of an overdose in a tent in August 2020.
Take too much of an opioid, and it suppresses your desire to breathe in your body, and so people just stop breathing, and that's what leads to death. And we see pockets of overdoses happening from a bad batch of fentanyl. They look like an oxycodone pill that someone would get from a pharmacy. And so, sadly, what we're seeing is that a lot of people who maybe aren't used to using opioids either are thinking they're getting a pain pill from a friend, and it ends up being fentanyl, and then they end up having an overdose.
Dr. Joe says what gives him hope is seeing people turn their lives around. He was one of them. Former English teacher and songwriter from Nashville, Tennessee, he got addicted to opioids following his cancer treatment health complications and opioid prescription.
At that time, they were prescribing that stuff pretty regularly and telling you that, it's not addictive, it will help you, and then it gets to the point where you just don't go anywhere and you don't do anything except lay up in the bed and watch TV and get high.
As the valve, as you will say, got cut off for inappropriate prescribing of prescription drugs, it created this basically this void in the marketplace. And what we saw was all of a sudden these counterfeit drugs come into our system.
In summer 2021, Lupe Hurtado started working as a peer counselor with the Tacoma Needle Exchange, community-based program that was established in 1988 with the goal to prevent infections associated with injection drug use by providing people with addiction clean syringes. The first person she was trying to help died from an overdose.
He was a veteran and he told me a lot of stories, and I was helping him get stabilized on Suboxone. I lost contact with him. We have a board in the front of where people can put pictures and mementos of people they've lost to overdose. And I saw his picture on the board. It was really hard to deal with.
Following the drugs market switch to fentanyl that is taken as pills or smoked, the needle exchange staff saw new requests for medicine that rapidly reverses an opioid overdose.
Lots of naloxone. We've seen a lot more overdoses, and we've seen a decrease in syringes.
Tacoma Needle Exchange team retrofitted a van to provide supplies for homeless encampments around the city of Tacoma and for tribal outreach.
So we loaded up with supplies, and we have drawers here, safe sex items, the works, so cotton cookers, ties, tourniquets, socks, wound care kits, toothbrush, toothpaste, internal condoms, and then drive it to the site, and we will sit here with it and offer supplies to people out of it.
Critics of the program are saying that making the addict's life more comfortable reduces the motivation to start rehabilitation. Needle exchange staff cite research that found that offering help without judgment brings people with substance addiction into the orbit of social services.
These people at a bare minimum deserve a human connection, somebody to care for their health and well-being, and that's what we do.
Doug DeJoe says that with fentanyl, the chance for timely intervention may not be there.
I really don't know where this is going, but it's scary because people are just dropping.
All parts of U.S. society are touched by the synthetic opioid fentanyl.
We see it in rural, we see it in inner cities, we see it in any race, any gender, it's affected.
There are communities hit harder than others.
Really communities of color that are disproportionately impacted by overdose, that fentanyl has really exacerbated some of those disparities. Specifically, American Indian Alaska Natives, Black individuals, and Latinx individuals have experienced disproportionate impact.
It kind of made me feel even more as a target. It felt like I was more exposed as a person of color. I just didn't like to be sober. I, felt like me as myself was not enough, and then it was out of control. I lost my apartment, I got evicted, I lost my job, and I was homeless. I also worked as a sex worker. That's how I sustained my habit and was able to survive.
Loss of custody for her older son and a new pregnancy convinced Lupe to seek treatment.
I was on Suboxone throughout my whole pregnancy. My son was born, he was healthy, and I continued to use Suboxone. I go to therapy, I help others, that's how I stay sober. And I got custody of my older son back.
Lupe says that her own experience helps her empathize with those who face similar challenges.
Stigma in some ways equals death for some people. Overdose, especially with fentanyl, is like the #1 accidental death, cause of accidental death in Pierce County. People feel ashamed about their drug use, thus they use alone. And when you're alone using, you can't save yourself from an overdose. Narcan saves people's lives, but someone has to give you Narcan. It's not something you can give yourself.
We don't know how long fentanyl is going to be around. We don't know what the next drug is going to be, and we don't know what the next drug after that is going to be. Things come in waves, and they affect people differently.
In hope to lower the numbers of fatal fentanyl overdoses, naloxone boxes provided by the Needle Exchange program are being installed next to the first aid kits in Tacoma public institutions.
Just hold it like this. You don't want to drop it because it can deploy the spray.
Tacoma Public Library staff learned a new skill: how to administer naloxone, a drug that can temporarily reverse opioid overdose. A new vending machine allowing patrons to get naloxone for free joins the hot coffee and the COVID test that library offers these days as part of its services.
I'd like to think that I would be able to do it, but I might need to find somebody else just to support me if I needed it. We were a little bit nervous at first just to see what people's reactions were going to be.
Yeah, it's a community hub, a place for people to gather, and so it's, just the ideal place for something like that, because you never know who's going to walk through the door and who's going to need, help.
Putting it up in a public vicinity of the public is letting them know that it's okay to do it. I carry Narcan on me because I have friends that do it, so but I don't think you should go in public places because there's kids in this space and stuff.
Gabi Fuentes, library's manager, says opioid crisis is the reality the community is dealing with.
Things have changed so much in the pandemic for our community. We've seen more poverty, we've seen more drug use, we've seen overdose deaths. So for us to fill that information and resource need, it was a clear next step for us to move into this partnership with the Needle Exchange and provide that resource to our community directly. A lot of people have reached out to us to say they've lost family members to addiction recently, and this, just knowing that they have the tool to be able to prevent a death like that has just been so important to our community.
Healthcare experts believe that making naloxone more accessible to the public could prevent scores of deaths from overdose.
There's good evidence we keep seeing over and over and over again that of all of the populations you want to make sure have naloxone, it's people who use opioids and or those who are friends and family and loved ones of them. They're most likely to see an overdose and most likely to see the greatest number of overdoses.
For unsheltered people, there might be no one around when Narcan could save their lives.
I mean, the worst you can get is you find somebody dead out here, because that's the end game.
In the suburban and rural communities, homelessness coupled with drug addiction can be less visible than in the big cities. For Kent Hay, homeless outreach director in Auburn, it means daily walks trying to convince people living in the parks and in the woods to get treatment and shelter.
Elizabeth.
He has been coming to this encampment by the Green River for more than 2 years.
So I need to get this done.
Yeah.
All right.
When homelessness is coupled with drug abuse, moving people to shelters is a challenge.
It's hard to get those people to participate in treatment. I just had a guy, I took him to get on Suboxone treatment. We've been working together for a while, and he'll disappear, and he'll do some things and then disappear.
Some will find themselves on the streets again and again.
The majority of people who come out here don't have this one problem. It's chemical dependency and mental health, and mental health and CPS, and just like the guy we saw, court orders and court conditions.
Addressing the combined challenges of fentanyl addiction and homelessness can be politically polarizing. King County Council member Sarah Perry says the solution requires response on multiple levels, including community involvement.
These are not people coming from other areas either. There are people. They come from our zip codes. They stay in our zip codes. These are our kids and our parents and our siblings and our cousins. They can't just go away somewhere. We have to own this together and do the right thing so everyone has a safe place to live and everybody feels safe walking around.
Letting drug addicts decide when they're ready for treatment is inhumane, says former County Council member Kathy Lambert. She wants mandatory inpatient rehabilitation.
So I know in the very beginning that you don't want to be there, and that's fine. But 2 or 3 weeks later, when you have the alcohol or the drugs out of your system, all of a sudden you see things very differently and very clearly. And that's what these people need. They need a place where they are essentially forced to use the time to get their bodies cleaned up so that they can make good decisions. And like anybody else, if you walked along the street and you saw somebody having an appendicitis attack, you don't say to them, I'll take care of you when you're ready. You immediately scoop them up and get them services. That's what's needed here.
Unlike other chronic conditions, drug use is often seen as an easy choice, which can be far from some people's reality. Mia Pridemore says she started using drugs at 15.
My parents were drug addicts, and my whole family was drug addicts, and it was accepted. It was social. It was almost expected.
The more exposure a person has to an adverse childhood experience or some type of trauma makes them much more susceptible to developing some type of substance use disorder or some type of addiction down the line. And if we can provide the right support for people, then people can heal and people can get better. If what we're doing re-traumatizes people, causes people more pain, then we're going to be in this cycle of not being able to not being able to heal as a community and not being able to work with the people who are struggling to heal.
At the University of Washington's Center for Community-Engaged Drug Education Research, Dr. Caleb Banta-Green says improving social and medical services is more effective and less damaging than mandatory treatment.
Because your risk of overdose when you come out is dramatic. And also, it is a type of scarlet letter that lasts for a long time. Arrests are not benign. They impact people's education opportunities, work opportunities, housing opportunities. They are not benign. They are harmful. And so before we start trying to force people to treatment, what I would argue is, why don't we make far better treatment services that people actually want? Because when we do, they line up for it.
For Mia Pridemore and her boyfriend Thomas Carpino, it took over 6 months to get the treatment and move to the subsidized housing.
I knew I needed to get off the pills because it was either jail or death. You know, all my friends around me were dying from it.
I was looking at myself as more like a death dealer, dealing out the pills, and after losing family members to them, then I seen the ugliness to them, and I didn't want to sell them no more. But I was addicted to them, so I couldn't stop doing them.
Brad Finegood, behavioral health advisor for the Seattle and King County Public Health Department, says fentanyl is 50 times more powerful than heroin.
One of the big differences between fentanyl and other drugs is it has such a short half-life. It's so powerful, and it has such a short half-life that it goes in and out of people's systems so quick. After a while, people aren't using because they want to get high. People are using because the withdrawal symptoms are so severe to keep themselves from getting sick.
Pridemore and Carpino say they were able to hold jobs while abusing other drugs. With fentanyl, it became impossible.
It takes you over. It's like you don't care about anything else but your next fix. You know, I had a nice car, and I had a home, and it's like lost all those things because all I cared about was my next fix.
They moved 230 kilometers from the town of Yakima to Auburn that took proactive approach in dealing with the opioid crisis, establishing walk-in clinics for patients suffering from substance addiction.
It's pretty challenging to switch over from fentanyl to buprenorphine, which is the medication that I prescribe here in the clinic. And with other opioids prior to fentanyl, that switch could happen pretty easily within a day.
For some addicts, Dr. Kittle says recovery will be continued medication, akin to insulin for diabetics.
But there are people who can make lifestyle changes, can change their habits, can change the people they're around, can change the environment they're around, and maybe the medicine's good for a year or two, and then they can kind of come off of it because the rest of their life has improved so much.
With monthly injection of buprenorphine, Pridemore and Carpino say they're feeling hopeful for the first time in years.
I'm not on the streets anymore. I have a home, I have a roof over my head where I can take showers every day and sleep in a warm bed every night and warm meals every day, and I look forward to getting a job and staying clean.
It was like I couldn't live life. It had its hold on me, and there was no getting out of it. Now with just waking up, not being on pills, it's a relief.
The National Institute on Drug Abuse estimates that the relapse rate for opioid addiction is between 40 and 60%.
It's hard to follow through, right? The follow through is not there. That's the issue.
In his 2024 budget request to Congress, President Biden called for $46.1 billion investment for National Drug Control Program agencies. It may help to curb the opioid surge, yet, while there is the lethal drug supply and demand, be it curious teenagers or people self-medicating to overcome traumas, outreach workers such as Kent Hay will likely keep walking, meeting those suffering from addiction where they are and trying to get them help.